Welcome to another episode of the Counselor Soapbox video channel. This episode, Drug Counseling, Part 8, includes an overview of the drug counseling field. An important question to ask is, does substance abuse counseling work? The results of a meta-analysis of treatment tell us some interesting things. 25% of those people who had treatment were abstaining at the end of 1 year. 10% drank only moderately. What about the rest? There was an 87% reduction in consumption. They abstained 3/4 of the time, and they reported 60% fewer physical health problems. Unlike treatment for many other conditions, the majority of clients in substance use disorder treatment are mandated to treatment. They've been referred by the courts or parole or probation, possibly by CPS as a result of problems in parenting. They can be referred by welfare. Here in California, CalWorks programs will refer people to treatment. Employee assistance plans, their work may have sent them to treatment. Student assistance programs are becoming more common, and many people are referred to treatment by family or friends who say, if you don't get your substance use disorder under control, then we've had it with you. So who are those people who are addicted? It would be nice if we could say, oh, that particular group of people are the addicts. But long-term studies have told us that there is no one personality type. The search for the addictive personality has proved fruitless. While certain characteristics may increase the risk, no matter what your personality type or background, you too could become addicted to substances. Treatment of substance use disorder is a very unique field. Most of the clients do not go for individual therapy. Treatment is typically part of an organized program, and treatment is commonly done in groups. The use of self-help groups is the rule, 12-step groups being the dominant type of self-help group. Many programs require the people in their program to attend a certain number of self-help groups each week. And most counselors are peers. They are themselves in some form of recovery, or someone in their family has been affected and that brought them to the treatment field. There are a few common models of treatment, sometimes referred to as modalities. The most common models of treatment are the therapeutic community. In this organized treatment, people who go through the program and graduate stay on to become the future counselors. The Minnesota model is also a common way of organizing treatment. In this, professionals run groups, provide curriculum, and so on. There are medical models, which are principally run by doctors, and there's a thing called 12-step facilitation, in which the principal organizing method is to teach the clients the 12 steps and encourage them to work these steps with a sponsor. Treatment can be offered in a variety of settings, sometimes combinations of these settings. It can be offered inpatient, which is residential treatment, the traditional 28 or 30-day episode, or sometimes longer, 90 days. Treatment can be offered in outpatient settings. People come in the evening or Saturdays, weekends, or for so many hours per day. Treatment can be aftercare. Someone could go through inpatient residential treatment and then attend, or go through outpatient and then attend once a week aftercare sessions. And some treatment is still provided in medical settings. People who are at high risk of medical issues, strokes, or heart attacks when withdrawing, may initially be treated in a hospital or medical setting. ASAM, the American Society of Addiction Medicine, created a tool, the patient placement criteria, to be sure that people are receiving appropriate treatment. This is especially important when insurance or other funding sources referring clients and wants to know that they're getting treatment that fits their needs. In this model, point 5 is early intervention for at-risk people. 1 is outpatient treatment. 2 is intensive outpatient or partial hospitalization. Level 3 care is residential inpatient. Level 3 care can be divided into subcategories. 3.1 would be clinically managed low intensity. This is conducted with non-medical personnel. Level 3.3 is clinically managed medium intensity, and level 3.5 is clinically managed medium to high intensity. Level 3.7 is medically monitored intensive outpatient. And level 4, the highest level, is medically managed intensive inpatient done in the hospital. As the number goes up, the skills needed by the provider increase, first from paraprofessionals to licensed professionals, and finally to medical doctors and medical professionals. There have been some issues for people in getting substance abuse treatment. Substance use disorders and mental health problems are often seen as not medically necessary. The money and the treatment doesn't flow to them in the same way they do to physical health problems. More funding flows through criminal justice, and jails house the majority of those with both substance use disorders and mental health disorders. Here are some examples of the various treatment modalities that may be used in substance abuse counseling. Some of these modalities can be combined so that a single client might receive services in a number of different ways. Brief interventions could be a single day. Screening is important to identify people who are at risk of developing a use disorder or who have one but aren't conscious of that. Outpatient is typically conducted 1 or more times per week. By definition, outpatient treatment is limited to 10 hours a week or less. That might be 2 hours a day, 5 days a week, or it might be a 3-hour session 3 times a week. Could be as little as an hour or 2 hours once a week. Intensive outpatient is done when the treatment is provided for 10 to 30 hours a week. This is a lot of treatment, or can be, but it still allows the person to come for treatment, go home, eat their meals, and sleep at home. It's much less expensive and can be less disruptive to people's lives. Day treatment or partial hospitalization is almost residential treatment. They may be there all day, but the clients still get to go home at night. Day treatment or partial hospitalization is often done in a hospital setting. It might be in the outpatient clinic attached to a hospital. Residential treatment can be subdivided into 3 models. Social model, which is basically non-medical. Medically supervised, which means a lot of the staff are drug and alcohol counselors or mental health counselors, but that a doctor or licensed person is overseeing the treatment. And medically managed, which means that the doctor and licensed therapists are on duty all of the time, even though there may be some participation from other non-licensed people. What happens after treatment? It's important to think of substance use disorders as chronic disorders. So someone doesn't go for treatment and now they're cured. Treatment plans may include short-term and long-term goals. Some of those long-term goals will not be completed while the person is in treatment. The plan for reentry into the community will also include things like vocation, getting the job, educational goals, housing, and some type of aftercare. A number of collateral services may be used which are not part of the treatment program but are necessary or helpful. Detox is one of those collateral services. It's important to note it is not treatment. The majority of people who go through detox end up relapsing within a very short period of time. Another effort in that direction is called sobering centers. A great many people arrive at the hospital under the influence of drugs or alcohol. It's possible to set up close to the hospital a sobering center which allows people under the influence to go there for a longer period of time to be detoxed. Sober living centers can be very helpful in bridging the gap between treatment and re-entry into society. It provides housing while the person looks for work, and it reinforces the goals and values that were learned during treatment. Sometimes these are called halfway houses. That term often applies to people being released from prison or incarceration, many of whom have done a drug or alcohol treatment program while incarcerated. There are many faith-based programs. Some of them, one locally, Salvation Army, describes itself as work therapy. The idea being that one of the things drug addicts do is get out of the habit of getting up in the morning and going to work. All of the faith-based programs have strong religious components. Typically, they do not accept government funding because that would mean that they could not impose any religious requirements on the people who attend. There are also 12-step and support groups. These are run by people who are themselves in recovery. They're self-help groups, but they're very helpful to people who are in formal treatment. There are also things like harm reduction, which can be coupled with formal treatment. One would be for people to be on methadone maintenance, which might help them with the urges to use opiate drugs while they are in treatment to change their lifestyle from a drug-using lifestyle. There's also a thing called wet houses, in which the people going there are allowed to consume alcohol as long as they do it in their own rooms and don't cause problems. This helps them to bridge that gap from a life on the street to being able to withdraw from drugs while still believing they are acting like other people in society. One thing that comes up frequently is, can you counsel clients who are still using? I think the answers have proven over and over is that it's possible to work with people who are still using or even under the influence, but it's certainly not as effective. Ideally, for treatment to be maximally effective, the person should go through detox and be withdrawn. Also, a new item is Narcan, naloxone, which is a medication that can be used to very rapidly reverse the effects of an opiate drug. Having it on hand and having people who know how to use it can save lives regardless of the location. There are a number of treatment facilities specifically for special populations. One of those are programs aimed towards pregnant women. There may be special difficulties involved when women have been using drugs and suddenly try to withdraw. It's often common to have gender-specific programs, either for women or for men with children. Many programs are moving towards being co-occurring capable to treat people who have both substance abuse and mental health issues at the same time. Some programs are specific to veterans, some are specific to prescription drug abusers, and we now see a movement towards chronic pain clinics where people with chronic pain who must take medications to manage it can get services for their pain and still be monitored for illegal or undesirable street drug use. What's ahead for the Counselor's Soapbox video channel? More in our Learning About Drug Counseling series, more drug education videos, and a series on mental health and wellness. If you've enjoyed this video, please click the like button directly below. For more information, please visit the counselorsoapbox.com blog, where you will find articles on mental health, substance abuse, and having a happy life. The David Joel Miller fiction and nonfiction books are available on Amazon.